Welcome to the Ohio Dual Adolescence to Young Adult Special Education Study Guide for Field 061. This exam measures whether you have the knowledge and skills needed to teach students with disabilities in grades 7 through 12 in Ohio public schools. In the next few minutes, we will break down the two domains that make up the first 40% of this test, so you walk into your exam feeling confident and prepared. Before we begin, there is a free study guide workbook linked in the description below. It includes key terms and definitions, comparison tables, practice questions with an answer key, and space for your own notes. Download it now so you can follow along. This video is brought to you by TeacherPreps.com, where you can access complete study guides, full-length timed practice tests, vocabulary exercises, and AI-scored constructed response preparation, all designed specifically for Ohio teacher certification exams. You can get started for free at TeacherPreps.com. Let's start with the exam format. The Ohio 061 exam is a computer-based test with 75 multiple-choice questions. You will have 90 minutes of actual testing time, which gives you roughly 72 seconds per question. The total appointment is 1 hour and 45 minutes, because you get a 15-minute tutorial before testing begins. You need a score of 220 to pass. The exam content is divided into 4 domains. Domain 1 is students with disabilities, worth 20%. Domain 2 is assessment and program planning, also 20%. Domain 3 is learning environments and instructional practices, which is the largest at 40%. And Domain 4 is foundations and professional practice at 20%. In this video, we are covering domains 1 and 2, which together make up 40% of your score. Let's begin with Domain 1, students with disabilities. This domain has 2 competencies. Competency 1 asks you to understand characteristics of students with disabilities, including typical and atypical development across cognitive, speech and language, social-emotional, and physical domains. Competency 2 focuses on factors affecting development, learning, and daily living, including the roles of family and community, disability impacts on daily life, and medication effects. Together, these questions test whether you understand who your students are and what shapes their experiences. Under IDEA, there are 13 disability categories that qualify students for special education services. The most common is specific learning disability, which accounts for roughly 1/3 of all students receiving services. Other high-incidence categories include speech or language impairment, other health impairment which includes ADHD and autism spectrum disorder. Lower incidence categories include intellectual disability, emotional disturbance, hearing impairment, orthopedic impairment, visual impairment, traumatic brain injury, multiple disabilities, deafblindness, and developmental delay. For secondary students in grades 7 through 12, you need to know how each disability presents differently in adolescence compared to younger children, especially regarding executive function demands and social complexity. You are expected to know 5 developmental domains and how each one is affected by disability. First is physical development, covering motor skills, health, and puberty-related changes. Second is cognitive development, including the shift from concrete to formal operational thinking, executive function skills like planning and self-monitoring, and working memory capacity. Third is communication development, which covers both receptive and expressive language, pragmatic language skills, and how communication difficulties often intensify during the social demands of adolescence. Fourth is social-emotional development, including identity formation, peer relationships, self-advocacy skills, and the heightened risk for anxiety and depression in teens with disabilities. Fifth is adaptive behavior, meaning the practical life skills a student needs for independence. Remember that development across these domains is interconnected, and a delay in one area often creates cascading effects in others. Competency 2 asks about factors that influence a student's development and daily functioning. These fall into 4 categories. Biological factors include genetics, neurological conditions, and chronic health issues. Environmental factors include poverty, exposure to toxins, housing instability, and access to nutrition. Family and community factors include parental involvement, cultural expectations, sibling dynamics, and the availability of community resources such as vocational rehabilitation agencies. And school factors include quality of instruction, access to related services, and the attitudes of educators and peers. You also need to know about medication effects. Common medications for students with disabilities can affect attention, appetite, energy levels, mood, and sleep patterns. As a special educator, you must monitor these effects and communicate changes to the IEP team and families. Let's try a practice question from Domain 1. A 10th grade student with a specific learning disability in reading has begun withdrawing from peers and refusing to participate in group activities. Which approach best addresses this student's needs across developmental domains? Option A. Increase the frequency of one-on-one reading intervention sessions. Option B. Refer the student to a school counselor for individual therapy. Option C. Incorporate the student's interests into reading tasks while structuring peer collaboration opportunities. Option D. Move the student to a self-contained classroom to reduce social pressure. The correct answer is C. Option C uses a strengths-based approach that addresses both the academic deficit and the social withdrawal simultaneously. By embedding the student's interests into reading instruction, you increase motivation and engagement. By structuring peer collaboration, you provide supported social interaction rather than avoiding it. This reflects the principle that development across domains is interconnected, and effective special education addresses the whole student rather than treating each concern in isolation. Options A and B address only one domain each, while Option D restricts the learning environment unnecessarily. Now let's move to Domain 2, Assessment and Program Planning. This domain also accounts for 20% of your exam. Competency 3 covers assessment procedures, including assessment terminology, formal and informal assessment types, strategies for selecting multi-level assessments, response to intervention frameworks, and how to collect and interpret data without bias. Competency 4 addresses individualized program development, including the ETR and IEP process, transition planning, placement along the continuum of services, and integrating life skills with academic instruction. Assessment drives every decision in special education. You need to know the difference between norm-referenced and criterion-referenced tests. Norm-referenced assessments compare a student to a representative sample of same-age peers, producing percentile ranks and standard scores. These are used primarily during eligibility determination. Criterion-referenced assessments measure whether a student has mastered specific skills or standards, and they drive day-to-day instructional planning. You also need to understand key psychometric concepts. Reliability is the consistency of test results over time. Validity is whether the test actually measures what it claims to measure, and standard error of measurement tells you the range within which a student's true score likely falls. For secondary students, also know the 3 tiers of response to intervention. Tier 1 is core instruction for all students. Tier 2 is targeted small group intervention for those who are struggling. And Tier 3 is intensive individualized intervention before a referral for evaluation. The Individualized Education Program is the legal document that drives a student's special education services. Required IEP components include present levels of academic achievement and functional performance, measurable annual goals aligned to those present levels, a description of special education and related services to be provided, supplementary aids and services, how the student will participate in state and district assessments, the dates, frequency, location, and duration of services, and for students age 16 and older, post-secondary transition goals. The IEP team must include the parents or guardians, at least one general education teacher, a special education teacher, a representative of the local education agency, someone who can interpret evaluation results, and the student whenever appropriate, especially when transition planning is discussed. For Ohio 061, remember that your students are in grades 7 through 12, so transition planning will be a significant part of many IEPs you develop. Transition planning is critical for students in the 7 through 12 grade band. Under IDEA, the IEP must include post-secondary goals beginning with the first IEP that is in effect when the student turns 16. These goals must address 3 areas: education or training after high school, employment, and where appropriate, independent living skills. Transition goals are driven by age-appropriate transition assessments that evaluate the student's interests, preferences, strengths, and needs. Community agencies, such as Opportunities for Ohioans with Disabilities, county developmental disability boards, and independent living centers should be invited to IEP meetings when transition is discussed. The student must also be invited to attend the meeting. Effective transition plans connect classroom instruction to real-world outcomes, including job shadowing, community-based instruction, and self-advocacy skill development. Here is a practice question for Domain 2. A special education teacher is developing an IEP for a 16-year-old student with an intellectual disability. Which of the following components is required to be included in this IEP? Option A, a detailed medical history documenting the student's diagnosis. Option B, measurable post-secondary goals for education, employment, and independent living. Option C, a behavior intervention plan based on a functional behavior assessment. Option D, a comparison of the student's performance to same-age peers on norm-reference tests. The correct answer is B. Under IDEA, the IEP for any student who is 16 or older must include measurable post-secondary goals addressing education or training, employment, and where appropriate, independent living. This is a legal requirement, not optional. Option A is not an IEP component. Medical history belongs in the evaluation team report. Option C may be included when a student has behavioral needs, but it is not universally required for every IEP. Option D describes an evaluation activity, not an IEP component. That wraps up Domains 1 and 2 of the Ohio 061 exam, which together make up 40% of your total score. You now have a solid foundation in understanding student characteristics, developmental domains, the factors that affect student learning, assessment types and RTI, IEP development, and transition planning. But there is still 60% of the exam to cover. Domain 3, Learning Environments and Instructional Practices, is the largest domain at 40% and covers classroom management, evidence-based instruction in reading, writing, and math, communication and social skill interventions, functional behavior assessments, and daily living and vocational skill development. Domain 4 covers the historical, legal, and ethical foundations of special education, including IDEA, ADA, and Section 504, as well as professional collaboration and reflective practice. To get the complete study guide covering all 4 domains, along with full-length timed practice tests and vocabulary review, visit TeacherPreps.com. Good luck on your Ohio 061 exam. You've got this.